there is something very special that happens during an FSM treatment that is very hard to put into words.
We're in a position of changing somebody's life in a very short period of time. Reduce inflammatory cytokines by 10 to 20 times in 90 minutes. We have data. What is the sound of courage? It's not a coincidence that every army in history has drums.
Yeah.
And that is the sound of courage in your bones.
I coach some of the most successful business people in North America, and it comes down to one very basic question, whether it's a $100 venture or a $100 million venture. Does this give you energy or does this drain your energy?
Thank you for subscribing to the Frequency Specific Microcurrent podcast. FSM is a breakthrough tool for medical practitioners who feel stuck with limited treatment options, especially for complex issues unresponsive to conventional care. FSM training is the best continuing education course for medical practitioners. Get our free introductory webinar at frequencyspecific.com/about or find FSM trained practitioners at frequencyspecific.com/find. Here's Dr. Carolyn Kim Pittis.
There you go.
We do. And it is always so funny because once a year, I wish it was more often that we get to do it in person because it is so much fun.
So much fun.
And I do feel like we're like talk show hosts, especially last year or this past advance where we had so many people join us for the podcast live. And I thought that was just, I don't know who had more fun, them or us, but
it was pretty much the same number of people that are usually with us live were with us in person, plus the people that were with us live.
Right, yeah. So we always have so much to talk about. I had to think about something from the advanced Monday and Tuesday in the clinic. And at the advanced, and you and I just talked about it briefly the other day on the phone, you still didn't get through all the slides that you wanted to. And that's just what happens when you lecture live. It takes on a pathway, similarly to our podcast. However, at the advanced, you had showed in the slides what I didn't tell you. And that was I guess the sub theme or the sub presentation of the advanced. And for the people that are listening, lay people, non-FSM practitioners, something very, and I'm not sure what the word is, magical, intimate. You had some very good adjectives that describe an FSM, what I call relationship, because treatment almost seems too clinical. And there is something very special that happens during an FSM treatment that is very hard to put into words. However, you did a very good job putting it into words, and it was very nice to bring, or for people who have had little to no FSM exposure, to have them listen to that part of the presentation, I think was very special. And I've had patients that I've worked with for years. And this past Monday and Tuesday, there were some very difficult cases that just weighed on my heart. And you leave the treatment and you leave the clinic and you're driving home, and they occupy a space in your heart, unlike any other profession, I think.
Yeah, it's true. I think it's because we tend to see, I would say, the worst of the worst. A lot of times FSM practitioners are the court of last resort.
Yeah.
And you don't get to vote. If you can help them, then it is magical. And most of the time, it's something simple like
Right.
thalamic stroke or phantom limb pain or nerve pain or, I don't know, abdominal adhesions or psoas trigger points or stuff that for us is easy.
Right.
So today I treated somebody who had described a fall she had down the stairs when she was a teenager, and she landed on her tailbone. And so I had done the supine cervical practicum on her. And then she told the story of this slide down the stairs and landing on her tailbone. And that sounds like dural adhesions to me. So I took her one of her legs and brought it up, and it had a hard stop at 90 degrees. And it's okay. So I took the wet towel off her chest and I wrapped it around her foot and did scarring in the dura and just did this and that and moved the dura and the pelvis and then switched legs and moved the other one. And then both knees, basically one at a time, went clear to her chest. And it was like, what did you do? And it's just scarring on the dura. It's not that hard. And so we're in a position of changing somebody's life in a very short period of time. And it requires an adjustment for both of us, because for us, it's like, it's just scarring on the dura.
Yeah.
And for the patient is, oh my God, it's been 40 years since I've been able to do that.
And those big changes were one of the reasons why I really wish Rock Tape could have come to the course, but they were so generous to give our practitioners codes for training and discounts and all the other things, because we create so much change so quickly that the more you practice with it, especially if you're like me and once you take the training, you can't not practice with it. I don't know how the practitioners do it who take the training and they have it. And yeah, sometimes they use FSM in a treatment. And I'm like, why, out of curiosity, not to be bratty, but like, why would you ever not want to use it? Just being curious. Because I am at the point where I won't treat without it. I don't want to lay my hands on anybody unless I can use FSM.
I don't know how to. So
How to treat without it.
somebody else came in today where I am, and he said, I have this knot in between my shoulder blades, just on the right. So what do you do? He said, on the weekends, I drive race cars. Aha. Have you ever crashed? And he looked at me like I was from Mars. And he said, yeah, once or twice. Okay. And then I went, does this hurt? Ow. Okay. So lay down. And it's not that hard. So I just ran 124 and 710 for the non-FSM people. That's just torn and broken in the disc annulus, and that knot in the middle of his back and this sore spot in front are connected because they're all the disc annulus.
Right.
So the problem with the disc annulus is that it has an owie and has a little crack in it. And that's what 124 fixes. I ran it for about 10 or 15 minutes. This was no longer sore. He stood up and he went, oh, that thing on my back is gone. Sure.
Yeah.
And those are the ones that you can fix that are easy.
Yeah.
And then there are the ones where this is a maintenance problem, and this is how we're going to maintain it.
When it comes to conditions like ALS, MS, Parkinson's, the cases that break your heart that you wish you could do more, I have to stop myself sometimes and think, yes, this is still progressing, but I wonder how fast it would have progressed without treatment. Or I wonder, so there's things that I want to add to the what I didn't tell you, because, and it's not the you want it more than the patient. I do believe that a lot of these people that I've been working with is a team effort. We both want the same things.
Yeah.
But it is knowing if you are up against a progressive disease, it is a progressive disease. And the maintenance, maybe it's not maintenance at that point, maybe it's
Slowing progression is progress. Slowing progression.
progression is progress.
Slowing progression. So with early stage Parkinson's, so sooner is better in MS, ALS, and Parkinson's.
Yeah.
If we get them early,
Yeah.
then it just extends the progression much longer.
Yeah.
And so I've had early stage Parkinson's patients, George for one,
Yeah.
FSM, dopamine precursors, and mitochondrial support
Right.
to repair the parts of the brain. ALS, Sandra has presented 2 cases. She hasn't
Mhm.
published any of them because who wants to hear that ALS can be helped? But she's presented 2 cases of ALS that actually regressed.
Wow.
Early stage MS, we've reversed. Late stage MS, can't put tissue back that's not there. And stroke patients, sensory motor strokes, so far, knock on something, pretty easy to get the spasticity gone.
Right.
Strokes in other parts of the brain. What I told one patient was, I'll treat the brain part, but I don't have a frequency for that specific brain part. But if you treat the vagus, the vagus increases brain-derived nerve growth factor.
Right.
So what we're going to do is treat your vagus every single night and every single day and let your vagus repair your stroke. Now, she doesn't have any symptoms from any of the strokes that she's
Right.
had. And she's had mild ones, but some weird visual residuals.
Mhm.
But I'll let the vagus fix it. I can't
Right.
fix it. I don't have a frequency for that brain part that works.
Right.
The vagus increases brain-derived nerve growth factor, reduces glutamate, reduces inflammation.
Right.
Yeah.
Right.
And the what I can't teach you is more about the emotional uh, stuff
Load. Yeah.
is going to hit you at some point.
Right. And it's like that roller coaster where there's days where it hits you, and then there's days that you're on top of the world and you're flying high. And then there's days that it's like the universe tells all these people to jump on a bus and come to your clinic the same week, just when you start getting cocky.
Yeah.
Just to keep you humble. And I think it also helps you go laterally with your thinking. If you would have told me 10 years ago that I would be treating these people, I would say, I do sports. No, I do sports. However, the people that I am seeing in MS, ALS, Parkinson's at later stages were once an athlete. And so I can still talk to them like the soccer player, the track athlete, the gymnast that they were. And I'm finding I'm grateful for my sports background. So I can say, okay, I want you to pretend to kick a ball. Show me your stance when you would go into your pyramid or something. And you can see the joy, you can see the memory of that movement. And I feel that that is a helpful treatment in my case to help connect. And yes, you can't put tissue back that's not there. But it's also shown me how to think differently about movement, how to think differently about tissue, especially. Again, I'll say it, keep saying it. It's the first core, 2 hours in, sitting there in Austin, Texas, and you're like, "What's never the muscle?" And my heart just sank. And I'm looking around. Is anybody else? Should we just leave? What do you mean it's not the muscle? That's the only thing I treat. Until I sat through the next 3 days, and it's no, you don't treat just the muscle. You treat the human. You treat the person.
The
You treat
cause.
them, yeah, and their entirety. And that to me is the game changer with the frequencies, of course, but
Yeah.
it's how to think about everything.
Yeah. Imagine telling David Simons it was not the muscle. That was an interesting experience. But that's the other thing that the advanced was about, the stuff that I added, the energy centers and the acupuncture meridians and more detail about the emotions.
Right.
It's about treating the person.
Yeah.
And so when you treat a former athlete or an athlete who also has the beginning stage of Parkinson's,
Right.
you're talking to the athlete who has Parkinson's.
Right.
So I had a friend that had rheumatoid arthritis, and I referred to her. This was way back before I ever thought about going to chiropractic college. And I referred to her in some way that indicated that she was her disease. And she said, no, I have rheumatoid arthritis. I am not rheumatoid arthritis.
Right.
I am a boxer or a football player
Right.
or race car driver
Yeah.
that has Parkinson's, but that's not who I am.
Yeah.
And I think the thing that FSM practitioners deal with that other people maybe don't, I don't know how, is how you deal with what in front of you. I'm really grateful I didn't get into medical school, and I'm really grateful I'm not a rheumatologist or an oncologist. Can you imagine having a profession where 100% of your patients are going to die of
No.
disease that you can't cure, or where the cure is as bad or worse than the disease? I, I, we're
Yeah.
that was, yeah. And then I remember the first time I presented that, what I can't teach you, was just after you showed pictures of me in high school and as a 3-year-old. It was hilarious.
Yeah. It's the journey that we're grateful for your journey, because without your journey, we wouldn't have our journey. And I think stuff like that needs to be celebrated and appreciated. And we are so grateful that you didn't get into medical school because
Yes, me
um,
too.
none of us would be here doing the amazing things that we're doing. So I think part of my car ride home Tuesday after work, after a very heavy day of just, did I even do anything? Yes, hopefully most people are leaving feeling better than then they walked in. But you just have those days of, man, that was a lot. And I wish I could have done more. And that is a perfectionist in me, wanting to do my best, give my best, and have the best outcomes. But also just appreciating and pausing for a second when you do have those tough cases that, how did you very simplistically put it? Slowing progression is progress.
Mhm.
And we have to be grateful for that too, is being able to find some to pull the brakes sometimes. Those of us who are working with athletes, it's all about go, speed up, do this as fast as you can, recover as fast as you can, get them back as fast as you can. But there is something to the slowing, the opposite of the go. So that was
Well,
proud of.
I am getting ready for this quantum biology forum next week, Monday and Tuesday. And the fact that we have data that shows that we can reduce inflammation, they wanted me to make it like a TED Talk. And it's okay. So go ahead and say it. How do you do this? You do it, you prove it, you publish it, and then you do something nobody else can do. Reduce nerve pain, publish it. Do something nobody else can do. Reduce inflammatory cytokines by 10 to 20 times in 90 minutes. We have data. Do blinded animal research. We have data. So we have data that says that these frequencies, when applied for this period of time in this situation, will reduce inflammation. That's data. So there's a comfort in knowing that if you can do nothing else, you can for sure do that. We have data that says we can increase vagal tone by 3 times in 15 minutes in strong responders. We have data that says we can do that. Well, if you can do that with the vagus, then you can do whatever the vagus does better. You can do that. So you know for sure that you can do that.
Right.
And if that's all you did, then that's what makes the last 30 years just magical for me, is that we have everybody just take a pause. In what world does some chiropractor from Oregon get data like that
Right.
from Australia, from NIH, from the Feinstein Institute? In what world does that happen? This can't be by mistake. It's so that everybody listening and everybody doing FSM has some confidence that they're doing something useful.
Right.
So that's
One of my favorite questions is asking practitioners and patients, like, how did you find FSM? I think the book has been a big part for the patients walking in the door. They've heard the book, they've read the book, they were given the book, they heard the book on audio. I think the book has been a very, very useful tool that everybody can read and appreciate the sort of the
yeah.
journey that you were on with it. The practitioners are another story because it's usually not the book. It's they were a patient walked in and demanded a treatment with it. And that was pretty much how I fell into it was we're going to use this. You better figure this out. Or all these guys are using it. You better come up to speed. Okay. Even inherently before my first core, like machines were evil. Like I didn't want to use devices. I had PT stuck in a room with a TENS machine. I couldn't stand those treatments because there was none of the what we're just talking about the last half an hour. The connection, the pathway, the troubleshooting, the stories, the treating somebody for 3 years. And then finally, after 3 years and one visit, they tell you what happened to them that changes the trajectory of the next treatment because now you've unlocked another layer of trauma to the tissue or something.
And the rest of the things that like a TENS unit, the devices are approved in the category of TENS. We can't make any claims for the devices beyond that. And we actually can't make any claims about the frequencies. We can, once a paper's been published, you can cite the published paper, but you can't make a claim about a frequency. I'm really clear about that. But where was I going with that? The, oh, TENS machines temporarily block pain.
Right.
They don't do anything.
I always describe them as they just create a lot of noise
Yeah,
in
yeah.
the tissue. And that's even just from an ATP amperage standpoint. So much amperage decreases ATP. It's created a lot of noise in the tissue, whereas FSM is the opposite. It's the little stealth bomber that comes in and comes out. Nobody even knows I was here. So, yeah, I don't even know where I was going with the whole pathway journey thing, but I find it very interesting how people find us and I'm grateful that I think the book gained that and the podcast like what we're doing right now is helpful for anybody to listen to just gain a little bit of hope and to think more laterally about their condition and not just accept the fact that for instance, had a patient who has their third concussion and is now being told you should probably stop contact sports. And it's what have you done to treat it other than lock yourself up in a dark room? And not much. And I'm saying, okay, let's figure out your vestibular. Let's figure out your musculoskeletal. Let's figure out the jaw. Let's figure out your vision.
Supplements to repair the brain. That whole obnoxious slide it's the only one I have that has what, 10, 12 bullet points?
Yeah,
Nutrients for brain injuries.
right,
It's,
right.
yeah.
But and it was sad to hear that nobody had given them after 3 documented concussions, any of this information. And the brain doesn't hurt itself without all these supplementary tissues and structures getting affected. And so I said, this is going to be overwhelming, but here's a whole bunch of stuff you need to look at and a whole bunch of people you need to find in your area, along with FSM as an adjunct that's going to make all of these things work better. So again, being grateful for not just looking at a concussion as a brain injury, but it's a small piece of a bigger problem.
Yeah.
Yeah.
The story I want to tell before we get
Yeah.
too far away from the
Yes.
book is how people find us. Starting in 1999, when I first started treating fibromyalgia from spine trauma, people said, you have to write a book for patients. And no, that's not how it works in medicine. You publish papers, then if you're lucky, you do a textbook, then you publish more papers, and then you publish a consumer book. And why? Because if you don't do it that way, then you'll never have credibility in medicine. And I wanted FSM to be credible.
Right.
Most people would have noticed that I've never spoken at one of the energy medicine conferences ever. And so we published papers, and then thanks to Leon Chaito, we got the textbook. Then we published more papers. And then I got a phone call one day from a gentleman, and he said, I've had Crohn's disease for 17 years, and one of your practitioners just put me into remission in 2 weeks. And I want to know why I've never heard of you. Why don't you have a book? And I said, everybody knows that you don't submit a manuscript to a publisher without a request. You don't submit a blind manuscript. Nobody's ever asked me. And he said, I'm an editor at North Atlantic Books, and I'm asking you. Okay. So he sent me the form, and I wrote chapter 1, and he sent it back, and he took a lesson from you, and he said, no, unpack it. And it's set up. Okay. So I waited, and then one Friday night after dinner, chapter 1 showed up in my head. It was about 2 weeks, 3 weeks later. And I wrote it in 2 hours. And then I sent it to one of my patients and my sister the next day to edit. They sent it back. We made a few changes. I sent it to him on Monday. He said, perfect. Now write chapter 2. So a week later, I wrote chapter 2 and then sent that to him along with the rest of the form, and North Atlantic Books accepted it. And then I got stuck halfway through chapter 3, couldn't get it done. Then I had June and July off to finish writing the book. And I was headed to Kuwait on a Thursday night, actually a Friday morning. Thursday night at 4:20, at the end of the day at 5 o'clock, the person who basically had Kevin's job,
Yep.
person who ran FSM, and his wife who ran PDI, both gave notice at 4:20 on Thursday night. And I was going to be in Kuwait for 2 weeks. And I said, you're going to stay and train the person we hire. No, we've got another job and we're out. Okay, you and Adam, who then had 2 or 3 really bad concussions. He had about 4 hours a day of awake time. So you and Adam interview people. They came up with Kevin. I got back from Kuwait on Saturday. interviewed Kevin on Monday, hired him on Tuesday, and we spent that June and July that I was supposed to write the book learning how to run the office, the computer system, the custom care software, which back then was a disaster. And then my due date was September 1st. Well, Roger Bellica said, I have this cabin in the woods up above Fort Collins. You could use that. It's okay. So George and I packed up and I wrote basically 7 chapters in 7 days, 6 chapters in 7 days. And just I'd go to sleep and wake up with the beginning of the chapter in my head. So we finished chapter 3 the first day, had lunch, went for a walk, wrote, had breakfast, wrote, had lunch, went for a walk, wrote, had dinner, wrote, went to bed, got up, usually slightly hypoxic at 5 o'clock in the morning, wrote, had breakfast. I did that for 7 days in a row. And that's why the book flows the way it does, because it was written all at one time.
Wow. I don't know if I knew that story.
Yeah, it was a thing. And then the prologue, so chapter 10 was easy because it was already set up to be written by the practitioners and the patients.
Yeah.
And then I just had a prologue. So I got back, and so I had I can't remember which birthday it was, 70th, I think. And on the weekend, Saturday, Sunday, and then treated somebody who came in as a patient on Saturday night, treated her. And that's what the prologue in the book was about, is why didn't she give up? How did she keep going? That's what you need. That's what I can't teach you, is why didn't she give up? And then, so that's the prologue to the book. And then I packed it all up and sent it off on September 2nd, 3rd, 4th. So 3 days late, which is not bad for a first book.
That's incredible.
It was,
I'm awestruck right now because I love writing. I love writing because I don't have to write. So but I understand the concept of waking up with something downloaded into your head. And I think that is a bit of a gift. It's a downloadable gift that you are blessed with when you wake up and say, this has to come out. The fact that it came out every day for 6 days is sort of
I
wild.
don't even know how I did it. It's Sister Ancilla was my high school English teacher, and she taught us how to write. And I remember waking up at 5 o'clock in the morning with the beginning of whichever chapter it was, but the phrase in my head was, what is the sound of courage? And it took me, as I read through the book, sometimes it's like somebody else wrote it. But as I read through that chapter, it took me a page and a half to get to that sentence. What is the sound of courage? It's not a coincidence that every army in history has drums.
Yeah.
And that is the sound of courage in your bones. That is the sound of courage. What is the sound? If it's about resonance?
Yeah.
What resonates? That was the other theme of the book that ran through it.
Yeah.
To make it more personal and
less clinical. Yeah.
Was what is it that you're called to do? What does your heart resonate with?
Yeah.
What do you resonate with? What are you called to do?
Yeah.
You do that, and everything else disappears. Everything else is easy. It's
Right.
not easy, it's not without effort.
Right.
But so people say, have you been doing this for 30 years? And it's been work, but
Right.
it's been easy. You just, as Kevin would say, you do the next thing.
And that is, so many of us are still in our love affair with FSM. I definitely am. I haven't been at it nearly as long as you have been. But when I think back to 2008, I mean, that definitely, I've plugged some miles since then.
Whoa, has it really been that long?
Yeah. I took you and I would have coffee in Switzerland in 2008 when my babies were napping. And that's
Wow.
how I spent a year just with my custom care and everything on DVD at that time.
Wow.
But to your point of waking up with the chapter, I would wake up thinking about frequencies. And it was that noise that I couldn't shut off and didn't want to shut off. And to me, that's what kept verifying the fact I'm supposed to be on this path. I'm not sure how it's supposed to work out. And then fast forward to 2015, and you and I are in San Francisco, and I'm like, I want to make a sports course. And here are three slides that I whipped up, and I don't know where they came from, but and yeah, you do the next thing. But I was involved in very close to getting into business with somebody in Canada. And we had a business attorney and advisor, and we were talking about how stressful this is. And I'm like, I'm not sure. And she says, listen, I coach some of the most successful business people in North America. And it comes down to one very basic question, whether it's $100 venture or $100 million venture. Does this give you energy or does this drain your energy? And the thought of FSM and learning and training and treating has always given me energy and inspiration and hope. And maybe that's the sound of courage also, is to just
Yeah.
what if, to have the courage to think about a condition a little bit differently, to have the courage to text Ben Catholi and Dave Burke and yourself and be like, I'm stuck on this, help. And for me, I hate asking for help. But when it comes to FSM, I love asking for help because I see it as an opportunity to learn something, which is my second favorite thing on the planet to do.
Exactly.
Right? So it all comes together. And I think we have to be just super grateful for all of that. But wow, a book in 6 days. I didn't think you were more amazing, but then I do.
Well, I had to. It was my first book. I couldn't blow it. And it was due September 1st. And we left for Colorado at I don't know, 8 days before, 9 days before that. And it's okay, got to get it done. And Roger Bellica made the cabin available. And I have a photograph of Roger Bellica and George Douglas sitting on the deck around Roger's A-frame. What he called as a cabin is this two-story A-frame house with a wraparound porch. And right, so there's George and Roger visiting, and it's so I have that picture.
Uh,
And so I couldn't not. And so you do what you have to do. And it was it just, and when I read it now, it's like somebody else wrote it. So there was a mystery author that I liked where it was Dick Francis. He always had something to do with horses. But the thing I knew about Dick Francis's books was that he, when I started one, I would, I couldn't put it down, and I would read, eat, sleep, read, eat, sleep, and it would be done in 24 hours because it was the next chapter. And it's because I had a book to write. It's like, how does he do that? So I brought Dick Francis books and I started reading them before I started writing The Resonance Effect. And I paid attention to what he did at the end of one chapter that
mm,
made you turn the page to the next chapter.
yeah.
And so most people I don't know what I did on page 157, but most people start it and can't put it down until they get to page 157. And I have to go look at that. But that I stole the idea from Dick's, and it was a good thing because the next thing was even harder. Really? What was the next thing? So
Yeah, right.
that was pretty
Right.
fun.
Well, and I feel like that's what happens with FSM. Like what a successful treatment is that we get so far in that hour and a half. And then for me, they leave with some tape on them and an exercise and something. And then it's like, what's going to happen next time they come in? It's
Exactly.
mystery unravels. And in a perfect scenario, they come in with the same amount of pain that they left the last treatment, if not lesser on the pain scale. But I always want my brain full of ideas. Like I come home from work exhausted sometimes and heavy, and my heart is full. And then I take a shower and I play with my dog and everything, make dinner and everything. And then you wake up in the morning with that chapter in your head downloaded of, oh, I think I'm going to try this next time.
Do that.
I think I have that. And sometimes it's even with patients that I'd seen years ago where I feel like, I don't know if you're better, but I think I have something else I need to keep doing with you. So,
I so want to call everybody I saw between 1998 and 2015 or so and say, come back. I
I
can help
have
you
the
now.
answer.
Yeah.
And that is a good, again, for the practitioners who are listening, that is a good reminder that you're not supposed to have all the answers all the time. You're not expected to, but the courage, I'm going to keep using that word, to just keep questioning and to keep exploring, questioning the patient. What happened? Is there something else that you can tell me about this injury?
Yeah.
And the courage for
And
the patient to reply.
yeah. And then the challenging part is, at least the part that challenges me, is when the patient totally believes the last three doctors that told them they're hopeless or they have this thing and this thing that they have is incurable. So once I give you a diagnosis that's incurable, then I'm off the hook. I don't have to do anything here. Have this tricyclic antidepressant and or this gabapentin and have a nice life. And the patient buys it.
Yeah.
And then somehow they find us and they tell me that story about the doctor said this, and they said this is what's causing it. I've learned to do that.
Yeah.
But it's really, they said, did they say anything about X, Y, or Z?
Right.
Might be the cause. Remember when you did that?
Yeah.
Oh, there are naturopaths in Portland who think it's normal to have SIBO for 10 years. Excuse me?
Yeah.
If you're not better in 6 to 10 weeks, something's wrong.
Yeah.
You take this antibiotic. You want me to take antibiotics? Duh. You have a bad bacteria that has to get killed, and there's a reason God invented this particular drug.
Yeah.
And then we turn your vagus on, and then we do this, and then you take butyrate, and then you fix the leaky gut, and then you do that. And if you're not better in 6 weeks, we missed something.
Right.
But they said, I know, and let's just pretend that this is a thing. Same thing with Ehlers-Danlos. How many of them come in and say, my right shoulder hurts? And oh, and I sprained my ankle. Tell me about your ankle sprain. I did gymnastics. How many times have you sprained your ankle? Sprain the right one 5 times and the left one 3 times. Put your hand on the desk and lift your little finger. Show me your thumb. Has anybody ever mentioned that you're hypermobile? Yeah, but when I come in and tell doctors that, they just tell me there's nothing they can do. And what's your body pain? That's about a 6. If you weren't ignoring it, what would it be? It'd be about a 7 or an 8. But if I say if it's an 8, then I'm drug seeking. Why are you asking me this? Because it's not that hard to fix. Excuse me? It's like, what? So when you can look at somebody in the face and say, nothing you have scares me. Okay. And then you fix at the end, they get up off the table, their pulse isn't 90, it's 67. Their body pain isn't a 7, it's a 1 or a 2. And their thumb doesn't touch their arm, and their elbow is a -2 instead of a -10.
Yeah.
Okay. But, okay. Oh, speaking of Ehlers-Danlos, I had the
Yes.
coolest thing happen.
Tell us.
You know how the knees are always the hardest to get?
Yeah.
Okay. I had somebody where 3 treatments into it, I had her for 5 days. 3 treatments into it, I could not get her knees to less than 12 or 15, 12 degrees, 15 degrees, something like it was a lot. And it's okay, this never doesn't work. What am I missing? So she'd stand up and her knee would stop at 0, and then she'd lock it and drive it back to a -12.
Yeah.
I wonder, that little,
Yes.
I wonder,
Yes.
what makes her sensory motor cortex think that knee belongs at a -12? So I did run one machine from her low back to her foot. It just torn and broken in the round tendon
Yeah.
and the hamstrings,
Yeah.
because I'd already run torn and broken in the connective tissue till I was blue and it didn't work. So
Yeah.
round tendon. But then I ran from her neck to her feet, increased secretions in the sensory and motor cortex.
Hmm.
What makes her sensory motor cortex think that her knee belongs at a -12? And I'll be darned if she didn't get up off the table at a -3.
I believe it.
I didn't, but it worked. And it's like, what made me think that? A little bird. It can't be the sensory motor cortex. No, try it. Okay, fine.
I know that bird. I've told the bird to shut up so many times, and I'm glad that the bird is more persistent than I am, because without it, I would be in my very safe bubble, just using 13 and 77 and 62 and 46, and that would be the end of my practice. But no, you're right to question why, what makes their body, brain, nervous system believe that this is the right way to do things. Challenge that thought. And I think there is something for running 2 machines at the same time in that scenario,
Oh, yeah.
because just loading a motor pattern, like that's how I think of it, 81 and 92 and 94, like loading that without paying attention to the underlying factor with the round tendon. I think that's where the magic happened with the 2 machines.
I agree.
Because just one doing it wouldn't have done it.
I don't think so either, because it really was the round tendons. When you look at the mechanics of it, the way you lock your knee
Yeah.
backwards
Yeah.
is the round tendon, not the
Yeah.
connective tissue one,
Yeah.
part of the hamstrings. And it's,
Interesting.
isn't it? I mean, and I think the other fun thing about this is that you learn something every week
Yeah.
by doing it. I love doing the podcast. I'm really glad that everybody listens to the podcast, but you learn by doing it.
Yeah.
By, okay, what did I miss?
Yeah.
What's, why is this patient all hunched over this way? It could be because her psoas is tight and she has dural adhesions that keep her bent over. So what if we do the psoas? And that's what I did today.
Right.
what if we do the psoas and the dural adhesions and a bit of her neck? And then she stands up and she's literally an inch taller than she was when she came in the door.
Right.
It's so fun.
And like I said, it puts everything that I love to do, help people and learn, and it wraps it up in the same little package that I get to unopen and unpack
Ties
every
it in a bow.
and ties it in a bow. Yeah.
I have to show you my shirt.
Yes, let's see it. Oh, it's a Snoopy. Oh, love
Yay.
Snoopy. I'm very lucky that I'm 2 hours from Santa Rosa. And when my kids were little, they used to play hockey at the arena right next to the Schultz Museum.
Wow.
I know. And it came full circle last year. My husband actually played in the Snoopy Cup. And so he's
No.
playing in it again so I'll have to go to the museum and take some pictures and grab you something when we're there.
Oh, that's so cool.
Yeah.
And the Snoopy Museum survived the fire, right?
It did, yeah, and so did the arena. So that was nice. A little protective bubble, I'm sure, was placed with prayer over top of that place.
Exactly.
If there's no questions, wonderful podcast. Thank you. Yeah, thanks, Alf. Thanks for
You're
everybody that came. I don't think we're here next week, right? There is something with you or with I next Wednesday. I can't remember. You're somewhere or
Next
I'm
week,
somewhere.
I'm somewhere. I'm in Washington, D.C. at the quantum biology conference
Tell
with
us quickly about what you're doing there before. I know my alarm's shutting, but
it's shut your alarm off. Believe it or not, they gave me 15 minutes to explain FSM, and the directions are make it like a TED Talk. And so it's introduce you and then do a little bit of this and a little bit of that. And you're supposed to be done in 15 slides for 15 minutes.
That's
Okay.
just mean.
It's just not possible. So I did what they said. It's over here, and it's the speaker template is your title talk, who I am, okay, how I got here, the big concept, frequencies change tissue, and then why this matters. Then you talk about nerve pain and low back pain and how many million and hundreds of millions of people have nerve pain, low back pain, neck pain. The science, duh. The mechanism, the evidence. And so it's do that in 15 slides after 30 years. And this is the first time they've heard about this. So yeah, so and it's a small group, I think, but Juliana Mortensen, who is the biophysicist, she's an MD, but biophysicist that lectures at the Advanced and Symposium, is part of she's one of the speakers. And she said, you have to have Carol or I'm not coming.
Aw, good.
Okay, so
Yeah.
Juliana's the reason we're there.
Great.
And speaking of which, next year, everybody that's listening, it's not going to be a symposium. I don't know that we'll ever do another one. It's going to be another 4-day advanced, and it's going to be a birthday party.
Yep.
And so in the afternoon, we'll have case reports. But
Yep.
that's where I am next Wednesday, is on a plane on the way home from Washington, D.C.
We can't wait to hear about it. So no podcast next week. We'll hear all about it the week after.
Yay.
And that's it. You continue to do great things where you are. That's very exciting.
You too.
Thank you. And we'll see everybody back here in 2 weeks.
See you in 2 weeks.
Bye.
Do good things. Bye.
The Frequency Specific Microcurrent podcast has been produced by Frequency Specific Seminars for entertainment, educational, and information purposes only. The information and opinion provided in the podcast are not medical advice, do not create any type of doctor-patient relationship, and unless expressly stated, do not reflect the opinions of its affiliates, subsidiaries, or sponsors, or the hosts or any of the podcast guests or affiliated professional organizations. No person should act or refrain from acting on the basis of the content provided in any podcast without first seeking appropriate medical advice and counseling. No information provided in any podcast should be used as a substitute for personalized medical advice and counseling. FSS expressly disclaims any and all liability relating to any actions taken or not taken based on or any contents of this podcast.